Well, Caroline, I think the timing is great to have the two guests we're going to have on today. It's a timely conversation that a lot of advisors are having with their clients, and businesses are looking at options when it comes to offering weight loss medication in their benefits plan because it's not guaranteed and companies have a choice. But when 60% of Canadians are either overweight or diagnosed as obese, and it's having a real impact. We're going to learn a lot of information today that's really powerful that goes to show that just offering a gym membership and a wellness program doesn't solve the problem. In fact, it only helps a very, very small percentage of individuals that are trying to lose weight.
Amazing. Yes, I'm really looking forward to welcoming back Sandra Elia, who is, so passionate and so well-spoken. She's the chair of Obesity Matters and has a great patient or plan member employee perspective. And secondly, bringing in Dr. Sandy Van. She's an obesity physician. We'll hear about her and all of her background, but I think this dream team will be able to have such a great conversation and bring out the facts about obesity as a chronic condition, but helping employers not only have a medical support, but mental, physical, and an environmental support for their employees to really encourage people to not be shy to step forward and take control of their health. So let's get them in here and get the conversation going. So welcome to the Benefits Alliance Voice podcast today. And we have a new guest and a returning guest. So let's start with our new guest, Dr. Sandy Van. If you could share a little bit about your background, and we'd love to get started that way.
Okay, well, I am an obesity physician and I'm a trained GP. That's what I trained in residency. But for the past almost decade, I've been practicing entirely in the space of obesity, offering both psychotherapy and medical management for people living with higher weight. And I'm also a medical advisor to Obesity Matters, which is a patient advocacy group.
Wonderful. Well, welcome. We're thrilled to have you join us. And welcome back to Sandra Elia. We're thrilled to have you back. And if you can introduce yourself, a bit of your background. And I will say, please do shout from the mountaintop the greatest, latest news of where you recently were and that whole experience. I'll be very mysterious about it, but you will tell us how.
Trust me, I do not miss an opportunity to tell everybody. So I am the chair of Obesity Matters, which is a nonprofit organization. We exist to advocate, educate, and empower people living with obesity. And we were invited to the United Nations Assembly this September to receive an award and all the good work that we've been doing for obesity, and in particular for our wellness workshop, which is a free resource and allows us to have health equity across the world, bringing in some of the top obesity doctors and experts like Dr. Sandy Van into the living rooms of people across the world. So that was a huge honor for us. And as a result, everyone's knocking on our door right now. And that's fantastic because we do want our reach to continue to be global. I am also an author, a professional speaker, and my day job is working as a food addiction counselor. And I have an outpatient program that runs in obesity clinics across Canada.
That's amazing. And we thank you both for being here, especially bringing your expertise to the listeners today, because it's an important topic and a hot topic when it comes to employee benefit plan management and decision-making and designing programs more than ever, because obviously obesity medication's been in the news a fair bit over the last couple of years, and we get a lot of questions as advisors on it. So we're very grateful to have both of you today. So I'm going to kick it off. What's the most important thing people misunderstand about obesity and being a chronic disease?
I can take that one. Obesity is irrefutably a progressive, chronic, complex medical condition. And we, for a long time, have thought of it as a lifestyle issue that's modifiable, when in reality, obesity is complex in the sense that there's so many things that can contribute to it. Which is why somebody can be put, like there can be 100 people that are in the exact same environment, but gain weight in different ways, right? So there's a lot of genetic predisposition that's involved, and up to 1,000 genes that have been identified that govern somebody's weight status, where they carry their fat, how much fat they can gain, how much subcutaneous fat versus visceral fat, what their metabolic risk is. A lot of that is genetically predisposed. And there are also other things that are more obvious, like the environment. We have this really predatory food environment that makes somebody who's more vulnerable to gaining weight thrive in terms of their weight. And what's most misunderstood about obesity is that a lot of people assume that people with obesity eat too much, when in reality, obesity's core symptom is appetite dysregulation. And that if you have a predisposition to it, you're more likely to have an appetite system that may seek out more calories than somebody who's born with a lean predisposition, might seek out more calories, might find more satisfaction with more calories or a different type of calorie, might find more reinforcement, and might find it harder to say no to the calorie rich environment. So that's one of the symptoms of obesity and the causes of obesity at the same time.
And I think what makes it difficult for patients living with obesity is this layer of stigma and bias that we all are the subjects of, because at the end of the day, everyone feels like they're an expert in weight management. Everybody, I had a doctor many, many years ago say to me, you know what, Sandra, we all like to eat, but you have to put in some self-control around it. And so there's a lot of this unsolicited advice, diet culture, many decades of programming that make it very difficult for people even to seek out treatment. And they feel like it's something that they should be able to handle on their own shoulders. So that's another layer to it.
Yeah. And our goal, certainly, when I think about, in the workplace, right? Rob sells benefits in the workplace, works with employers to design the plans. And ultimately, when we think about who we're trying to help support with employees and their families, there's so many factors to discuss here, right? There's drug coverage, but I think it all starts with exactly what we're currently talking about. And that's creating an environment that is safe and also supportive, but also the education around obesity as a disease. So much to talk about here. Let's dive into that part. What advice would you say you would give to an employer, successes you've heard about in how to creating that environment and education that doesn't, point fingers at, okay, let's talk about that person, or this, this is something we're trying to be supportive of. And a lot of medical conditions are like that too, right? Because when you're educating, then you're kind of sitting in a room going, well, okay, the people around us is who we're talking about. So how do you do that effectively? Any thoughts or advice there?
Well, if I can jump in, I think that employers can't ignore this. We know that in Canada, almost 60% of our population is either living with overweight or obesity. So this is your workforce. I think we go back to the idea that every organization wants a flourishing, healthy bottom line, which means you have to have a flourishing, healthy employees. And when you choose not to provide the support and the medicine that is available, then you are going to pay one way or another, right? So you can either pay for the coverage, or you can pay through lost productivity, absenteeism, short-term disability, long-term disability, which we have enough evidence that shows there is a link between living with obesity and chronic illness and time off of work. And also, I think it's time for a lot of employers to really understand if their work environment contributes to obesity. We know that shift work will contribute to obesity, low autonomy, working with maybe hostile people in the public. These are all significant contributors to obesity. So if your work environment has created this or contributed to this, then I think there's an ethical responsibility to also treat it.
And, with that, maybe flip it back to the members or the individuals that come see you, Dr. Sandy. Is there a common theme or reason that people are reaching out, or is there a common identity? When you initially spoke there, we obviously know that obesity is extremely complex, illness in so many different ways. It's not a factor that's contributed to that. So is there that common theme that you typically see with your patients that come see you?
You know what the most common ubiquitous narrative I hear is that their weight has been a longstanding issue, that it has been progressive over time. Some of the most challenging cases, meaning that there's a lot of body image dissatisfaction or internalized weight bias, and very self-critical thinking stems from early weight stigma, whether it's from their peers at school. Most commonly, I find that it's often modeled at the home, in the home, like by parents who might be showing weight loss attempts through restrictive dieting. I have patients who have said that they've been subjected to early onset dieting out of good intention, but unknowingly by the parent, causing this idea that their self concept is directly tied to their weight and that there's something wrong with them because of their weight. And to be told that as a child or as an adolescent and to remember these events so vividly, it has you think, okay, this person's been scarred by something. I can't remember too many things at the age of 8 or 9, but if somebody's telling me that their parents told them not to eat ice cream, but that their sibling could, and they remember that with like a type of salience that it was like yesterday, then there's something really scarring about that, right? So weight stigma is this really prevalent sort of factor, I think, in many of my patients' lives. And they continue to experience that oftentimes like they're in their adult life, whether it's through the workplace setting, whether it's through even applying in the most prevalent way I see it right now is when patients are denied coverage, or even that checkbox that says, has this patient tried diet and exercise before becoming eligible for treatment? As if that is the prerequisite to getting treatment. When diet and exercise wasn't going to work for many, like for most people, diet and exercise for somebody with obesity, it works like 10% of the time based on the weight loss trials we have. Like 10% of people who go on a diet or exercise regimen will see lasting weight loss, like persistent weight loss. But 90% of the population who undergo those interventions don't tend to see sustainable weight loss. They tend to see weight regain. And that's not because they haven't tried. They've tried many, many times. That's another theme that's very recurrent, is that a lot of the patients who come see me and ask me for medications, these aren't people who are looking for an easy way out. They have undergone the most torturous routes to try to lose weight, and to be denied access to a medication that they're hearing in the news about, that a lot of people are getting access to be denied that and to have tried so many times is really disheartening for them, and another form of stigma.
And it's almost baked in with that question
Yeah.
of, have you already tried exercise and diet? Because, we don't believe that you have. If you had done that, then you wouldn't need this prescription. But I guess since you're not willing, or, you failed at it, fine, we'll give you the prescription. And then to go to the pharmacy and not have it be covered when other medications are covered is another baked in stigma. It's like, oh, okay, I get it. Why would they cover this? I was supposed to diet and exercise.
I'd love to get into that conversation around medication in a moment. But, with Dr. Sandy, to continue that thought then, how has this changed your approach in kind of the conversations you have had with your patients that have come into you that will say, I've tried everything, but have you adopted your process, or are you seeing different approaches now and how you kind of treat your patients from that standpoint then?
Yes, I believe that anybody with obesity deserves access to real treatment, whether they've actually tried diet or exercise. And that's not because I don't think diet and exercise are important cornerstones to health. They are very important cornerstones to health. But if the outcome of interest here is weight reduction, and that weight reduction is going to contribute meaningfully to that person's metabolic health or mechanical health, meaning that it, releases the burden of weight on joints, and improves their ability to function in their day-to-day, or if it alleviates mental health. We know that people with depression, 50% of people with depression have obesity, right? So if it's going to relieve a very important domain of their health, then I'm going to take it seriously and offer them a treatment that I know is going to confer significant benefit as long as they qualify for treatment, right? And I'll liken it to this. If somebody came in with a urinary tract infection and I had a whole roster or a whole range of antibiotics that I could offer them, I'm not going to choose the antibiotic that has a 10% success rate, right?
Well said.
Why would I choose diet and exercise if I know that only 10% of people who try it are going to see meaningful weight loss long term? I'm going to choose the one that's going to give that person a higher yield benefit for the condition that they've never actually been treated for.
Yeah, and I want to pick up on one thing that Sandy said that I think is so important, that diet and exercise are cornerstones to health. And I think that we need to kind of drop that when we talk about anybody living with obesity, because movement and healthy food is for the 2-year-old and the 92-year-old. It's for somebody with a low BMI and someone with a high BMI. Any human needs really great food and movement to be well. And so it's almost a moot point, right? I feel like when we point the finger at the person living with obesity saying diet and exercise, wait a minute, shouldn't we all be doing that?
Definitely.
Great point.
I want to dive into a topic of looking back again at the whole person, because there's something that you said, Dr. Sandy, about the era and how you grow up as a child. Something you said just took me back to my childhood. Hey, it was the era. I grew up in the 70s and 70s, early 80s, and I can distinctly recall, even though I was very active in sports and all these different things, my mom saying, it's time for us to go on the 2-week diet. And, and I'm not saying this to be mean to my mom, but that was the era, right?
Yeah.
Every day it was
Normalized.
like, okay, you watched it and now it's time to do this for 2 weeks and really rein it in. And it really impacted me more than I think I realized over time. My question to you to start with is, I feel like now that I have a teenage daughter, I feel like the education in school that they're growing up with is different. It feels different. She's being taught how to look at labels in the grocery store and make choices. And I will share a cute little side story because I just have to. She's 18. She just got her credit card. She was asking me about how lines of credit work. And she said, do I get a better line of credit if I buy apples instead of like unhealthy food? And I was like, oh my gosh, that is such a really interesting question. But I think to rein it back, it speaks to how she's growing up. She's being taught how to make some choices, and then she still has her chips and her popcorn. But I just thought, anyways, my question to you is, do you think that kids and the generations are growing up differently to lend itself to a healthier psychology around the whole person and how they look at food?
Well, I'm going to let Sandra answer this only because she actually has an adolescent. My child's 5. Sandra's is 13, 14.
Going on, yes, and she's got quite the she's very adult, very mature, and she's very outspoken, and I think she is growing up very differently than I. First of all, she has role models that come in different body sizes, so she watches people on stage who look very different. It's not one idea. When Carolyne and I were growing up, there was only one idea of beauty: very tall, very slender, very blonde, and blue-eyed, and that was it. You didn't fit that mold, you weren't considered beautiful. And she just doesn't have the food hangups. There's no real good food or bad food. I am teaching her how to read labels, and it's more about sugar content or ultra processed versus good or bad. And I often think social media plays a big role. And I heard somebody talk about this, that social media is often a reflection of the teen's mental health, what it is currently. So if that teen is struggling with self-image and starts down the rabbit hole of maybe eating disorders or diet, then the algorithm knows them and it shows them more and more and more of the same. So my hope is that my daughter's coming from a really great place of self-worth and understanding that different bodies are accepted and loved and you can be successful. And that often is mirrored in her social media and what she looks at and how that is a reinforcing loop as well. But yeah, social media is kind of out of our control, but she's a lot wiser than I am. She knows photoshopping. She knows filters. When we were growing up, we didn't know. We would compare ourselves to the supermodels at the time, but the supermodels didn't even look like that because we were airbrushed. But now we're all in on the filters.
Involved with a couple nonprofit groups, and they used to say to the CEO of the great YWCA Hamilton, I'm like, there's a whole bunch of teenage girls coming through you do not need to worry about, right? They've got big personalities, they're strong on their feet. I think of, as you said, Sandra, it's because they've got great female role models in their lives. It's important, right? And it is. I think there is that generational that is changing, which is super. And kind of to dovetail that to today's working force that is struggling. What would you maybe talk to employers about? And you mentioned about, I think it was Sandra, you had said 60% of Canadians. And so that's a huge part of, like, if every organization says, well, I've got 100 people, that's a lot of people it impacts. And maybe it's not the employee, it could be their partner. So what would you say to these employers listening today about strategies about the why this is important, why they should be concerned?
Yeah, I was going to say with employers, sometimes they think that their wellness program will address obesity and they're separate. So if you offer gym memberships, fantastic. If you have some fruit in the lunchroom available to employees, fantastic. But that does not address obesity or somebody really having consequences from their weight that are affecting their physical health, their mental health, their home life. So having programs available, and that's where Obesity Matters comes in. We have this wellness workshop that was, validated by the United Nations, and it's a real plug and play. That's offering services that are targeted specifically to obesity.
Good. And let's I'd love to dive into some of the programs that you offer as Obesity Matters and other resources so that, as an employer is looking at, okay, here's my benefits plan, here's the, the medication, the psychology aspect, how we've set up our environment, like you just said. But what else is out there that is available to people to tap into just so they may promote that as well?
Our wellness workshop gives the community access to experts such as obesity physicians, dietitians, trainers. I think that and spiritual gurus, and it's just a nice touch point for people who live with higher weight to have access to experts and be able to ask their questions, but to also dismantle a lot of the weight bias that they've grown up with. Because we're really going against the current here. The natural current is to take you towards an ideology of you've done this to yourself. Like, we've made a lot of headway about obesity as a chronic disease, but we're still kind of stuck in our thinking about how somebody gets to a place of obesity. Like, oftentimes there's a lot of self-disparaging. Like, if you dig deep into that person's internal narrative, there's a lot of self-disparaging remarks, there's a lot of shame, there's a lot of self-blame, and a lot of that gets checked, right? When you get an expert that's coming on and saying, hey, this is actually why we naturally gravitate towards the apple pie over the apple. There's nothing wrong with you. That is just a hardwired, like, primitive sort of event that occurs in all humans to naturally gravitate towards the higher calorie item. And plus, it's positively reinforcing. And so you can see how somebody who struggles to make healthy food decisions in a day to day could create some distance between the setback and themselves, and they could actually view things more objectively if they understand the condition of obesity and the science behind it. They can actually maybe start cultivating a sense of respect and compassion for themselves for living with a predisposition to having it. And so it really helps break down some of the internalized weight bias that provokes a lot of this maladaptive behavior like that currently exists. So I think that that's one of the biggest pieces of the wellness workshop, that somebody's psychology can sort of get the shift in how they view themselves, and it leaves them more bandwidth to actually work on the things that actually matter to themselves, and it helps them redefine what success looks like beyond just what they see as a weight loss, but focusing on other metrics like, how do I behave? Like, do I behave in a way that's consistent with my overarching health values? How is my sleep? Do I get enough water? Do I get enough social support? Do I have enough people in my corner to help me with this? And Obesity Matters also does that. It provides community for a condition that is otherwise quite isolating.
Yeah. And I think what we know is that group therapy for the treatment of obesity is incredibly beneficial, even more so than one-on-one therapy. And within group therapy, you have social learning, you motivate one another, people feel like they're part of something. So that's also really important for employers to know.
So let's build on that. I think this is great. So for our millions of listeners out there, what would then good obesity coverage look like to both of you? Maybe I'll start with Sandy and then pass to Sandra, to you, so that they could, kind of build on some of these things that you're talking about just as an employer.
Yeah. So if we consider the pillars of treatment for obesity being the psychological support, the medical support, the surgical support, then it's really ideal to provide coverage for all of these pillars. And that includes obesity medications, which I know you alluded to at the beginning was a more hot topic these days. But I think it also includes access to other healthcare providers to provide a more holistic approach to weight management, including physio, social workers, psychologists, psychotherapists, also providing, like, if somebody does choose to undergo weight loss surgery or bariatric surgery, then providing them accommodations and time to be able to recover from that.
Sandra?
Yeah, I think we need to start with good treatment. And so for those who will benefit from an obesity management medication, understanding that that's not going to be the silver bullet, that you do need to support the whole person, and having the systems in place to allow them to really be able to flourish while taking this medicine. I always equate it to an antidepressant, right? An antidepressant is often not the silver bullet, but impaired for a person to be able to get sometimes their head above water, which then allows them to wake up and do all the cornerstones of health that each and every one of us should be doing. And the antidepressant gives them the strength and the bandwidth to be able to do it. And that's the way I look at obesity management medicines, and understanding that they will need support in all of the things around them.
Yeah. So as we start to wrap up this episode, I'm sitting here thinking about, throughout the year, an employer will run team building activities or gatherings around holidays. Right now, we're entering into the holiday season of Christmas, but this could apply to, as a timeless piece of advice, any event through the year, right? Or a team building exercise. So I want to talk about, how an employer could set up a successful team event, whether it's surrounded by a food, or whether it's an activity like a murder mystery party, or some type of, exercise, or out in the park, going in the forest, challenging, those types of things. There's all sorts of these team building, amazing race, simulation, that type of thing. So a lot of people have great ideas, but I want to talk a little bit about inclusivity and having careful thought to allow for an environment that helps everyone participate. Let's talk about that. Let's start with Sandra.
Yeah, I've been a victim of that. I used to work for a consulting firm, a Bay Street consulting firm, where I would say 98% of the employees were, new grads, very young, very fit, A-type, like just hitting on every level. And they would take us away every year. And one year they chartered planes to Bermuda. How exciting. And we were supposed to show up at the beach the next morning, and all my counterparts showed up in bikinis and swimming trunks. And I, at that time, was 100 pounds overweight. And it was Survivor Island games. And there was someone else on staff. She was our receptionist, and she was probably 60 years old. And both of us couldn't participate in team building activities. Isn't that bonkers, right? And so understanding that different abilities, different comfort levels, different religions, different cultural backgrounds. I remember there was also this, I had to put like an egg on a spoon and then get really close to someone else, and like our faces were almost touching, and that's not really comfortable for people. Or there was piggyback rides, and just, it was a mess. Now, I'm going to preface that it was 25 years ago, and I don't think they do it anymore. I don't know. I actually don't know. Things like having proper seating, things like we would go for Habitat for Humanity, and they would make up team t-shirts for us. But guess what? They didn't have sizes for everyone. Things like that. And understanding that food, I get that a lot of cultures believe food is love, and I agree with that. I think when it's an ultra processed, chemically engineered food that was made in a factory, nutrient poor, I don't know if that's necessarily love or the best way to show love. And when you have those treats in your kitchen all afternoon, you could probably chart your productivity going downhill. Some people, sugar affects their mood. So I think health is really a beautiful gift that you can give people in any way possible. And inclusivity.
This is the gift, I think. This is going to be a controversial statement, but I have been in patient calls all day, and every single time a patient brings up a corporate work party, it is not with any degree of positivity. And I don't work like I'm technically self-employed because I am a physician. A physician in Ontario is always self-employed. And so I've always yearned to have a corporate work party because they all sound so fun. But nobody seems to actually enjoy them, the people I speak to anyways. And so I think that companies can save on cost by not having the holiday work party that everybody's dreading, and give people the gift of time. Give them half a day off. Let them cut them loose half a day early, or give them some sort of stipend to go do something fun with family. I don't know, but I just feel like it's sort of this archaic trend that a lot of people may or may not enjoy anymore. And I also want to take this as an opportunity for a key message, because I know that many people listening might have rolled their eyes when we said obesity medication, of course. Like that's one way that you can give this like gift of health to your patients or to your employees. And I just want to emphasize a really important data point that I came across in my reading about the cost of not treating obesity. And it's that obesity is a major contributor to the top chronic illnesses driving up health benefit costs in Canada. And this includes type 2 diabetes, hypertension, depression, asthma, and inflammatory conditions. Upon my review of the top 10 medications that people have to pay for on an annual basis, most of these medications were either directly or indirectly related to obesity. And so when you treat obesity, you treat and prevent so many of these other conditions that may worsen over time and not only contribute to direct health care costs for the organization, but can also cost you in absenteeism, presenteeism, workers' comp, and all these other things that are well substantiated in the data on the economics of obesity. And you really do risk losing money by not treating obesity when these readily available treatments are accessible.
So I'm gonna bring you to all my meetings going forward, Dr. Sandy, because that's, we talk about it just for both of you and for everybody listening. There's no secret sauce out there. How a group claims drives their premiums at the end of the day, whether you have 5 employees or 5,000 employees. And there's different variances that go into it as like reasons why costs go up or costs go down. But sometimes, people get caught up in the fact, well, claims are up. So what do we do? Do we look at cutting coverage? Versus when you talk about what most people want to see, which can sometimes be tough to dictate in a benefit plan, is the ROI. Well, what's my ROI if I add an employee assistance program? What's my ROI if I improve the mental health practitioner benefits? So I think you made some important points there, that at a time when organizations are looking to retain their top talent, attract top talent, they're looking at other strategies, and we love our Christmas party. We have lots of fun. I'll leave it at that. But that's important about the variance, about like providing options. Yeah, big picture, absolutely right. It's critical more than ever.
You have to think big picture. We know that there are excessive medical costs associated with it. On average, I think it was cited that 6,400, like it's an employee with obesity costs an employer $6,400 a year. And that's in health related expenses alone. And then for somebody with overweight, it's roughly $1,200 annually in health related expenses. But that doesn't actually account for all the non-medical productivity loss that is conferred by the disease of obesity.
Great point.
Yeah. Great. Well, as we bring our episode to close, are there any final comments that anyone has from the advisor perspective, Rob, the employer perspective, the plan member, patient perspective about that you would want to make sure that the audience goes home with today? So maybe we'll start with Sandra.
I think that retaining top talent, I think that's really important. What is the work environment like? What benefits are you offering? Because if it's all about saving money, are you going to attract the talent that's going to take your business to the next level and be even more profitable and bigger? What is it like? We don't spend any more. The most time we spend is at work. And one thing that this consulting firm did very, very well was it made me feel like I was part of a family. I was there for 15 years. And I felt like they truly did care about me. Even when my mom was dying, they gave me so much time off, paid leave, never asked me to make up for it. And I was so dedicated to that firm, and I was willing to do go above and beyond as a standard because they made me feel like I mattered and I was important.
Thank you. Sandy, any final comments from yourself?
Yeah, I think that I just want employers to know that every person in their organization that has overweight or obesity has thought about their weight, has thought about it, and has tried. Most people have tried. And I think that it's important to recognize that these are individuals who want to provide quality work and who want to contribute meaningfully to the workplace. And they oftentimes won't even ask for the help to lose weight, most times, but it will say something about a company if it's offered to them. And it's in a very non-stigmatizing way. So I don't mean like offering it to them for a short time, like 3 months or just 12 months, or getting them to check in every 6 months to see if the medication's working or not. I just mean offering it unconditionally. And if it seems too overwhelming in terms of the cost, do a trial. Get some like feedback anonymously from people who are using it. I don't know how to do that anonymously, but it gives you a sense of the pulse of your community or your employees when you can do something like that. And I almost guarantee that it's going to be positive feedback. And I agree with Sandra, in order to retain top talent, this is the new standard, because I have catered to many executive patients in my practice, and a lot of them jump onto organizations that they know will offer anti-obesity medications.
Excellent message. Thank you. Rob, final word?
I think probably, first for Sandra and Dr. Sandy, thank you so much for joining us today. It was very, enlightening and I think powerful at the same time for employers to hear this. And probably I agree with both Sandra and Sandy in their comments. And last, you think of in every benefits program, we cover so many medications for chronic illnesses right now, right? Whether it's hypertension or diabetes, or it goes on and on. That, why would this be any different? And, the importance not only be attracting and retaining, but there's a great ROI right there, as kind of Dr. Sandy mentioned, about some of the expenses, and especially when people are looking for options more than ever before, right? It's forward thinking, and and I think, I'll be honest, I think my attitude is going to change dramatically in how I provide that type of advice as well to employers. So I really appreciate Dr. Sandy and Sandra being on today.
Amazing. Thank you both. Again, I echo Rob's comments. I learned a lot again today. I'll continue on this path, and I think we've given some great messaging to employers and even employees out there, plan members, as to how they can help us go forward and create health for all. So thanks again for joining, and we'll see you again soon.
Great. Thank you.
This has been the Benefits Alliance Voice. If you enjoyed this episode, please share it with your network, and be sure to check out the podcast notes for any additional materials.